Thanks so much for having me here today. I'm Katie Murray. I'm a urologic oncologist at the University of Missouri, and I have the pleasure to talk about Cxbladder in a case study discussion of patients that we see on a regular basis and the utility of an in-home sampling kit for utilization of Cxbladder monitor. So as we go through this, we're going to review things that come up in our regular practice, a review of different clinical scenarios where Cxbladder may be appropriate, understand the implications and clinical needs for ordering these tests, discuss how these results may ultimately impact our patient outcomes and satisfaction, and then also gain insights from ourselves as healthcare providers on the utility of this test in treating our patients. So let's look at a typical scenario, right? We all have these patients in our clinic. Here I'm just presenting a story of a 66-year-old female who is very well known to me, who I've seen for several years, who has a recurrent history of low-grade TA urothelial cell carcinoma. Of course, she lives 2 hours away from my clinic and has a lot of social implications, and part of that is taking care of her 13-year-old grandson, who does require nearly 24-hour care, in which she's the primary caregiver. She is a former smoker. She quit about 15 years ago. Scheduling to see me regularly. Her last recurrence of low-grade bladder cancer was 9 months prior. She's been treated previously with multiple TURBTs with immediate intravesical gemcitabine installation, and returns to clinic on average about every 6 months for a follow-up cystoscopy. Right, this is just one scenario. We all have so many scenarios of patients that we see in these exact situations, right? And what is that we're actually seeing? We're seeing these challenges for patients to come and see us for these routine visits that we've always felt are very necessary to look for recurrences of bladder cancer, right? What other challenges are there? We're all very busy clinicians. We have so many patients to be seen on any particular day. There's social situations of our patients to physically get in to see us. There's travel implications. There's caregiver implications. What kind of, do people have to take off work, to come to their visit? Does it, for this lady, for instance, it impacts her grandson. There's weather situations where patients sometimes cannot travel to come see us during weather. And then, of course, right, we're in 2021, 2022 here, and we're talking about a pandemic, COVID-19, things like children are not in their school sessions, and that forced us to reassess some of the things we do and look at weighing risks and benefits of in-person visits for patients with these recurrent bladder cancers, really thinking about our low-grade patients, but maybe even some of our high-grade individuals. Right, so reasons for ordering a test like this would be based on this challenge. This was the question that we were all presented with. Is it imperative? Does this person really need to come for an in-person visit and a cystoscopy as scheduled? Maybe we should explore something else to see if we can delay cystoscopies, or maybe we can skip some of these in-person visits and or extend the intervals between these in-person visits and cystos in clinic. Right, so what does a Cxbladder in-home sampling kit look like, and what does that flow look like? So, what is our responsibility? Ultimately, our responsibility for doing this is identifying patients, right? So identify the patients that could potentially seek advantage from having one of these tests, inform the patient that we are going to send this out to them. It's going to be shipped to their home. And then we complete the ordering forms that get sent to Pacific Edge via fax, via email, electronic share, just talking about the patient's history. What happens on the behalf of the company, Pacific Edge, then their responsibility is they ship out this in-home sampling kit to the patient that gives strict instructions on how to collect their sample at home informs the patient of any financial responsibilities with this test. They physically run the Cxbladder monitor test and then deliver those test results back to us, to our clinic, within 7 business days, right? Then what happens? We get those test results back, patient follow-up and clinic follow-up, and you can determine whether that's going to happen in an in-person visit. Are you going to delay a cystoscopy? Are you going to do it telehealth, telemedicine, or just a phone consultation visit with the patient? So what does that look like? This test request form for Cxbladder, right? It comes in 3 different formats, but what I'm talking about here is Cxbladder monitor. We're talking about collection dates, which really on this particular is an in-home target sample date. So you're giving the patient a time frame or a goal time date of when you want this test to occur. And then of course we have a diagnosis code, an ICD-10 for this patient, for instance, is a history of bladder cancer. So over the past year, I had the pleasure of treating, several patients, of course, with bladder cancer, as so many urologists do. And I explored using this in-home sampling test for my patients. And I used it 13 patients, was able to obtain results on 11 patients, and delayed cystoscopy on several patients, in both patients with positive and negative tests, with ultimately positive results from delaying some visits and delaying exposure to coming into the hospital with COVID-19. So during this time frame of using this, again, 13 patients had an at-home test. 2 patients did not obtain results due to excessive inflammation in their initial urine specimen they collected at home. Of those remaining 11 patients with results, 9 patients had results, and we proceeded to follow up with a cystoscopy within an 8-month time frame after. There were no false negative results based on this gold standard cystoscopy sometime within that 8-month time frame. Of those 11 patients, 5 delayed in-person appointments and delayed that cystoscopy for a mean of about 6 months. With 3 patients avoiding an inpatient visit altogether until at least November of 2020. So, this was something that we thought that looked very positive, of application where this test is something, that is somewhat familiar to urologists and patients as far as doing an in-home collection of urine and sending it back. And so we also asked our patients, how did this work? How well did you, were the instructions on getting this test completed? And when we asked all of these patients, 69% of patients rated the test, as saying 2 out of 5, 89% of them stating they would definitely consider using this test again, and it was not implication in their life, right? So how difficult was it from 1 to 5? 5 being the most difficult. No patient said that getting this urine collection at home was very difficult. A majority of those patients said that it was very undifficult, or the least amount of difficulty. And then, would you ever use it again? A majority of patients that responded said, yes, we would do the Cxbladder monitor test again in the future. Because the implications of that were not too difficult. And therefore, this, I think, is a great opportunity for us to really be thinking and exploring for our patients. And maybe one of the positives that has come out of a pandemic, and reassess what we're doing. Are there tests out there, such as Cxbladder monitor, that we can do on our patients, that they can do from their home? We can review the tests, and it can change their care without harming them from an oncologic standpoint in cancer. And that's all I have for you today.